Hello. Okay, so this an assignment need to be complete. So XBEP 4103 Environmental Health Practice Assignment. So we are discussing, representing the Minamata Disease. So I'm Sharizal from Learning Center Shah Alam. So we will quick view so introduction of mercury poisoning, environmental and disease, legal action that has been taken for the Minamata disease case, strategies that has been taken to reduce or eliminate Minamata disease, suggestion on strategies to prevent this issue from happening in Malaysia. We go to the introduction of the mercury. Mercury is a very heavy toxic arise from the degradation of the Earth's crust through volcanic eruption to the ocean, from the ocean. So the mercury extensively used in the production of skin and hair bleach, antiseptic, electrical lamps, batteries, and thermometer. Mercury exists in the three forms: elemental, organic, and inorganic. Mercury vapor is particularly easy to dispose to the atmosphere. Exposure to any form of mercury, either for single or very high dose, repeated basis, can lead to disease, acute and chronic mercury poisoning. And in this mercury, there are three main symptoms of mercury poisoning. You have gum problem, mood, mental changes, and disturbance in nervous system. The effect of the nervous system are normally observed by psychomotor impairment. And then the other health effect, when you have exposed to the poisoning of the mercury, you will feel the skin allergy, loss of appetite, discoloration of the eyes, and skin and irritation on skin and eyes. So if you see from the left side mercury, they have three forms: elemental, organic, and inorganic. So organic, they are divided into two: alkys and aries mercury. In organic, they have three forms. So I just speak briefly about the poisoning from the organic, elemental, and inorganic. For poison in the organic, they are found in abundance, especially in the seafood. They are absorbed by gastrointestinal tract and distributed to most of the tissue. So the sign of the symptom of the organic mercury, you will feel a memory loss and also the loss of vision, and they will affect the central nervous system. So initial symptom of the organic mercury, you will feel the loss of confidence, insomnia, emotional stability, and forgetful. And then we go to the poisoning from the elemental mercury. So elemental mercury is the most common of the mercury in thermometer, in barometers. They were using in our daily use. Then after inhalation, for example, when you inhale the mercury, 70 to 80% of the so it will go into blood circulation and absorb from the skin quite easily. There is acute inhalation of the mercury vapor may be followed by chest pain. You feel chest pain, you feel hard to breathe, and then coughing, chills, and fever. So this symptom can observe within the hours after you got exposed of the elemental mercury. So we go next to the poisoning from the inorganic mercury. So when ingestion of the inorganic mercury, it can be to bring you to fatality, and also ingestion symptoms, you can vomit, you will feel something metal in your mouth, and then complex symptom of the disease, you have redness in the palm and so. Reaction of the mercury reactions, so they feel allergic, and then some dose acid intoxication. So in aquatic uh, in mercury in the aquatic, so aquatic organism, particularly aquatic insect, it can mercury and retain in their tissue, and then the food chains will happen circulate. So the large predator fish or man will expose a high level of mercury from them. So we just uh, have a quick view about the Minamata disease. So Minamata is a small fishing town in Shiranyo Sea. So most of people there they did a lot of fish. So Minamata disease has been discovered in 1956 by the release of the mercury from the Kiso company. This happened from 1932 to 1968. So this one is have been lost, like 2,665 victims have been recognized. So 1,784 have been died. So the Kiso company till now they are keep paying neurological syndrome caused by severe mercury poisoning affecting the central nervous system. So when people there, the townspeople there, exposed to the mercury, so they feel numbness in their hands, and then have muscle weakness and narrowing their vision. So this is the summary of the Minamata disease. So we go to the summary history. History. So Kiso Corporation, they first opened their factory in 1908, and then 1982, the factory have started aldehyde production, and in 1950, the people in the Minamata begin their notice their cats and going crazy with some strange happen around their town. And lips. So has some difficult hearing or seeing. Others develop shaking, and then shouting, uncontrolled. So, and on April 21st, 1956, a 5-year-old girl has examined their symptoms, difficult to walk and speak. And then on May, the hospital director to the local public health, they are saying that epidemic happened, disease from the central nervous system. So they have officially discovered about the Minamata disease. So they have formed the strange disease community to investigate this epidemic. And then the research group finding Minamata disease on November 4, 1956, considered to be poison from the heavy metal entered the 1959. After 3 years later, the researchers from the Kumamoto University discovered the source of illness, the heavy high mercury poisoning. And in 1968, the Kiso finally quit poisoning Minamata waters. So it's taking a lot of time before they quit. So next. So the mercury happened in water. The mercury have bioform by bacteria in the water, and then the pollute the fish. So the fish affect the cats, the cat fish. So started in the town cats in the mid 1950s. People in Japan begin notice they are going crazy, and we never this. Then the earliest victim is the small children. Environmental contamination happened rapidly, and there's the outbreak keep widening.